Yeah, you are
Oh,
here.
how are you?
How are you?
I'm doing good. How about you? Crazy days
Yeah,
that we live in.
what time is it now?
Not 10 in the morning. It's 10 in the morning
Oh,
over here.
in the morning. So now
Yeah,
I'm at like 9 p.m. tonight. So
9
we are
p.m.
like the opposite part of the world.
Yeah, oh my God. So you're ready to go to bed, huh? And I'm starting my day.
Before you joining us, I already introduced you that you are the most requested international speaker in any conference. And thank you
Uh,
very much for joining us in AMWC Euromedicom for tonight.
it's my pleasure. I love you guys. And I miss you. I miss all of you. I miss the meetings, learning from all of you is was something that we need to adapt. And you could see humans, we are very resilient because we are realizing that sometimes we don't need to travel so far in order to learn something. And this is a good platform to learn. So until things get better and we go back to normal, I'm gonna be learning a lot from you by following you on your social media, Zoom meetings, webinars. That's what I'm gonna do. I pledge to be a better version of myself. So this is a good time to learn from each other.
Yeah, I will go over at the end of our discussion about your upcoming webinar with Euromedicom. But before so, can we start with introducing you and me before? So all the audience will know our background a little bit. Let me introduce myself first. I'm Dr. Rungsima. I'm from Thailand, practicing in Bangkok. I'm a dermatologist and also a dermatologic surgeon. And how about you?
So Shino Bay Aguilera, I practice in Fort Lauderdale, Florida. I'm also a dermatologist and a dermatological surgeon. But for the past, I think, yeah, oh my God, over 20 years now, I've been
20
doing
years.
aesthetics.
You don't look
Yeah.
like people who practice for 20 years.
Yeah, I mean, I started as a laser expert, and way before I started into getting into dermatology, I've been three different type of doctors. I was a
Mhm.
family practitioner, then hospice, and then I got into dermatology, which was my dream. I never gave up my dream, and but I was already doing laser work and research with cynosure lasers. And then I got into dermatology, and then aesthetics is my passion, so I've been doing aesthetics for a long time.
You train some other doctor too. Can you tell me about what do you train other doctors?
Yeah, so I'm a speaker and trainer for all the three major companies here in the United States, which is Galderma, Merck, and Allergan. And I do a lot of trainings for them. But also, I'm an assistant medical professor for the dermatology programs. There's 5 different universities that come to train with me, the residents from United States, and then one from Colombia, which is Universidad del Rosario. So I teach all day long, every day, and the weekends.
And
Aesthetics. Aesthetics.
for, for the last year, I also sent my fellows to be with you, and that was their opportunities to observe and learn from you. Thank you very much.
No, I'll do anything for the residents. I know how it is to be a resident, and they're hungry for knowledge. They want to be better. And I think when we teach residents, I feel like I will leave my legacy behind. I think I will leave a little bit of me will be always in their work, because that's how I feel about all my mentors. They're always with me. You never cut that umbilical cord with your mentors, and that is something that's worth doing.
Yeah, and thank you again very much for being with us tonight. Before we going on to how you rejuvenate male patients, how was the COVID situation in Florida? Just like let me know what's going on now.
So at least where I live, because everywhere in Florida is handling the situation a little bit different. I don't know if you heard, but just 2 days ago, Jacksonville, Florida, which is closer to Georgia, they allow people to go to the beach now. The beach are open, the parks are open. People now are ready to go back to work. Where I am, people still a little bit afraid. We practice social distancing. Uh, all the gyms are closed, all the parks are closed, all the beaches are closed. My practice is closed. I tried to hold on as much as I could, um, out of my own money and the practice money to pay all my employees. But yesterday we had to let them go temporarily so they can apply for unemployment, which is something that broke my heart because I can take more than they can this situation. But they live pay by check, they have family. So I held on as much as I could, but now the government will assist them. And I'm hoping that this is just gonna be for 2 weeks and I'll be able to bring them all back and we're gonna be able to practice. That said, it's gonna be very different the way we're gonna practice now, the way they're gonna recommend for me to practice, which I feel like I'm only gonna be able to see 50% of the patients that I wanna see, not because they cannot afford it, because the way that we need to practice, you cannot have a patient, more than 2 patients on the waiting area now. So that's gonna limit the traffic. So there's a lot of changes that are coming and we're getting prepared for that right now. That's why we had a meeting yesterday, preparing for the new world.
Yeah, I think after COVID pandemic, even speaking about our, I think we will have something change forever. Like, how we treat the patient or how we see the patient. I think we still practice social distancing for a longer period of time.
Yeah, but I feel like after a few months, maybe 6 months, maybe a year, we will start going back to the way we used to interact with each other. It's not possible for humans to be practicing social distance forever. We're not designed for that. We need the human touch to thrive. I'm Latino. I kiss and hug all my patients. That's gonna kill me, and I know that eventually that's gonna fade because without the human touch, we will not be able to thrive. We'll be depressed. We'll be anxious. We need human touch in order to thrive.
And it will be very difficult for us, like, aesthetic doctors who really need to get our hands on patient's face, just to make it perfect. Yeah, it will be very difficult for us. So in Thailand, are still under lockdown, and everyone needs to wear masks when going out. So that will I don't know will to practice my clinic. Hopefully, can the June. Keep my finger crossed.
Yeah, we just need to trust in the universe, God, whatever you want to call it, that everything happens for a reason. And I think the planet needed a reset, and all of us needed a reset. So Mother Nature has sent us home for a while to be able to think about how we conduct ourselves as individuals in society, and how can we be better to each other, to the planet, to nature, and eventually we will be the better version of ourselves if we put our own individual work into it.
Yeah. All right. Okay, let's get to the topic of today. Male rejuvenation. How many percent of male patients coming in?
So in my practice, I'm kind of lucky because I'm in Fort Lauderdale, Florida, and there's high gay population, gay men. So gay men tend to do more aesthetics than straight heterosexual men. That said, it's only 20% of my practice. Now, I was part of a study in the United States, and the study only was for heterosexual male. Okay, so only straight heterosexual male. And what we discovered was that men, they want to do cosmetic procedures as much as anyone. They think that the men that are older, the baby boomers, they feel a little bit embarrassed about getting them. They usually will come and they will say, my wife sent me here. My girlfriend wants me to get rid of this CrossFit. They never said, oh, I want to do this, because they feel that they need to have permission either by their wife or girlfriends or a male friend that is doing cosmetic procedure, because they say, oh, is John is doing it, and he plays football, and he drives cars and motorcycles, and all the ladies like him. Well, if he's doing it, I can do it too. So that patient population needs permission. It's different from the millennial and younger males, where they're more adventurous. They want to do these procedures. They have no shame about getting them because they see a value on prejuvenation and preventing the aging process. So when we did this research, we found out that, to round things up, only 10% of the population of men do cosmetic procedures. So it's a huge market to be tapped into.
Yeah, I think so. So when comparing to the last 10 years, there is the percentage of male proportion of my patient increasing as well. Uh, but for you, what is the main concern, and what is the most common features that they ask for?
So for the older patients, the baby boomers, they hate CrossFit. So that's the norm. Men, if they're gonna do a neurotoxin, if you ask him which wrinkle bothers you the most, it's not gonna be the 11s, it's not gonna be this wrinkle. They hate their CrossFit. For whatever reason, they think it makes them look older. The younger male, the ones that are doing beautification or enhancements, they're really doing things to increase the secondary male characteristic that makes a man look attractive or more handsome. So they ask for jawline, chin, and strong cheeks.
How do you have the percentage of younger people coming? I think Dr. Stefano, who is attending our Insta Live now, he asking how young the patient, what is the youngest male patient that you ever see?
So I think the youngest I've treated is about 23 to 25 in my practice. My practice definitely there's not a lot of millennials. When there are millennials, they tend to go to my millennial junior partner. At the beginning, it's just like I'm older, and my rapport is better with the older patients. The millennials tend to have a lot of pressure. And that's why I lecture about how to be responsible when we put content in social media, how to attract millennials. Because what some of my colleagues are doing without knowing it is causing a lot of stress that leads to a lot of mental issues in the millennials or the younger generation, because they feel this pressure that they need to look certain way. So I see it more with females. With males, it hasn't happened, but with the females, they do a lot of Kylie Jenner specials and Kim Kardashian special, trying to use the likeness of a celebrity to make them feel pressure to do procedures. Luckily for male patients, we don't see a lot of our colleagues in the industry doing this to them, but there's some pressure for them. So the male patients, they come with their own ideas. They're already well versed. They've done the research, and they want to look a certain way in order to be more attractive. They're very demanding. And again, because of that, I let my junior partner deal with them better, because I think he can relate to them better. To me, I didn't have the patience because I don't relate. Because I see a very good looking man, I say, but why do you want to do this to yourself? You already look like that. I think that my junior partner is better with the younger population because he's young like them, and he will be more sensitive to their needs.
I think for younger generation, they tend to have the pressure of looking so perfect, from all the social media. So they need to be good at all times. Photograph in real self.
Exactly, and one thing that we need to see is like the big elephant on the room is that the younger millennials and younger than millennials generation, in the male, we have a surge of narcissism that you never saw with the older generation. Like my generation, of course, there's narcissists at any age group, but with the with the younger generation, the narcissism is even higher, which we have to be careful when we are treating younger males. It's not just inject, and do procedures for the sake of profit. We also need to guide them and give them a support mechanism if we see that they're going down this dark hole. So it's very important for me when I treat my patient, whether they're young or older, that I also give them a spiritual facelift. It's not just injecting them, it's also guide them, you know, because they have a lot of insecurities that can get propagated and make it worse by social media. And we need to protect our young generation, because remember, they're going to take care of us. So we don't want mental health issues on this generation because of what the content that's being put out there.
Yeah. During the consultation, you tend to take time longer or shorter comparing to female patients?
Actually, with the males, I took less time. One thing that is good, most males, they don't want a lot of explanations, right? They just say, don't make me look weird. Don't make me look weird. Just, that's all I'm asking. Give me something that I'm not going to need a lot of maintenance, because I am not going to be here every month to do things. I just want something that I'm not going to look weird. I don't need a lot of maintenance because I'm not that type of guy. I'm low maintenance. And please, you know, make it cost effective for me. That's what I meant. So one good thing about the male patient is that they don't cheat on you like women do in terms of aesthetics, okay? They're loyal. They're loyal. If they like you, they're not going to go here and there and another, which with females, they go, oh, I get all, they go, I'm sorry, I cheated on you because my friend took me to this place and they had a good deal, and I didn't mean to, but my friend made me do it. I hear that all the time with my female patients. My male patients are loyal. They don't cheat on me.
Yeah, that's so true. And let's get into the treatment plan. So normally when you have the patient, do you tailor-made? How you tailor-made the protocol? You mix and match, right? You use multiple procedures or multiple technology at once. What is your plan? Like, you know, you can go area by area, or you want full face?
Yeah, we could do, let's do area by area, knowing the fact that some patients may not have the finances to do a full face. So then we'll target the area where the patient and I will agree that this will be the best enhancement for the budget that they have. The other thing is that if they have poor quality skin, I always like to treat the skin first, right? Because you don't see the fillers, you don't see the neurotoxins. What people always see is your skin first. So skin quality is very important. So if somebody has severe sun damaged skin, I would say, let's fix your skin first. Maybe because we dermatologists, we think like that, but I think it's the right thing to do. Now, going from top to bottom.
Or what technology for the skin quality that you like most?
Yeah, so
Laser?
if they have severe, laser. So any of the energy-based devices, the lasers is what I go to. And then, of course, I have them maintained with chemical peels, microneedling, and things that my estheticians can do so they can continue gain improvement on the skin or maintain the result that they have achieved with my laser treatments.
So since we are dermatologists, do you also prescribe, like, you know, cosmeceutical, something that they can use at home? Like for
Of course, it's very, very important to always give the patient integrated skin systems or protocols with cosmeceuticals. Why? 80% of all your patients, when you do a cosmetic procedure, studies have shown that 80% of them will go to the mall and buy something for that procedure. The problem with that is that they don't understand what they just had, and they may buy the wrong cleanser, the wrong moisturizers that can cause an adverse reaction that can lead with dermatitis, inflammation, and post-inflammatory hyperpigmentation. But the reasoning of the patient may be, oh, the procedure went wrong because the doctor did it wrong. They're not going to blame the product. Or sometimes they understand that they did it to themselves by not using the right product, but then they question how good you are as a dermatologist that you did not tell them that they're not supposed to use a cream with retinoic acid after a laser, or a cleanser that has glycolic acid after a microneedling procedure. So do yourself a favor. You need to prescribe a protocol with the right cleanser, moisturizer, and sunblock for the patient to be able to get the best result from that energy-based device or microneedling or chemical peel.
Totally agree. How about moving on to the something else? You just go like area by area. For me, what your favorite treatment?
Yes, so let's start from the top to the bottom. So we know that the operator is where the man is weak. We are very weak at the operator, while women, they're very strong on the operator because you're really smart. Well, reason why if you look at a man, if you look at a man operator, yes, we can take care of the writers, the wrinkles with neurotoxins. That's simple. We know it works. It's fast. It's a win-win. Everybody's happy if it is done correctly, right? Because we can make a man look a little weird or feminizing with the wrong technique with neurotoxins. Now, men, if they're starting to age or genetically they have less fat, severe bossing brow, or the operator is dropping because they're losing bone from bone loss, bone rebuilding, and fat, then you can do frontoplastic techniques with fillers, which is a technique that's very gratifying because sometimes I feel that we become so neurotoxin dominant on the operator that we don't look at the operator and realize that it's aging with lack of volume, and the volume needs to be replenished there like anywhere else on the face. Now, going a little lower, the teardrop. The teardrop is an area that the younger millennials or the older patients can benefit. For example, I'm a quarter Chinese, so I have deep teardrop. So I need to do fillers on this area because without it, I look very tired. So, but I look like that since I was 7 years old, right? It's my genetics. But the problem that at almost 52, it looks really bad when my teardrop is really sunken. So using a filler in this area that is not so hydrophilic, because choosing your products is very important. For the teardrop, I will use a filler that is not hydrophilic, that is cohesive, that doesn't want to break down easily or separate. And I like to use supraperiosteal techniques, little aliquots, because they're all going to throw water to themselves. Now, the cheekbone. This is an area that has to do a lot with genetics.
Just 1 second. I think, Prof, I want you to go over a little bit because it's a very challenging area for males. That to the cheek chubby looking or female. Yes. Is there any technique you can prevent that happening?
Yeah, so if you're going, before you do the teardrops, I always say that you need to work on the mid-face first. So if the mid-face is not up to par, then going to do the teardrop without helping the mid-face is not the right sequence because you will never be able to get a good result on the teardrop if you already have V-shaped deformity for lack of volume on the soothe and the medial deep fat compartment. Now, like you said, you don't want to have a lot of anteromalar projection. So for a man, when you want to work on the mid-face, you want to use more of the product laterally to lift. Studies have shown if you start laterally instead of medially, you're going to lift a lot more the face. And you want to keep this area flat when you compare it to a female. Male don't need OG curve or a lot of antimale projection because it's going to look very feminine and it's going to look weird. What you do need to know is that you need to give support to both the and the area of what is called the teardrop ligament. You want to give support in those areas before you go actually in the teardrop itself. Because when you give support to those two ligaments, you are going to lift the ligaments and the teardrop is going to look a lot better even before you go and inject in the teardrop. And that allows you to use the smallest amount possible of hyaluronic acid in the teardrop because we know that there's always a potential for swelling. Now, whenever you're going to pick a product for the mid face or the lower face, you have to use the highest G prime product that exists. Why? Because it will give you contour. Men have to be straight line, chisel, angular. It cannot be soft and doughy. If we look at each other, you look beautiful. You have this nice, soft contour. Nice. Me, you see me, I'm very angular, very chisel. We both have fillers, but you have a filler that it makes you look feminine. I have a filler that is hard, that makes me look more chisel. So when you pick a filler for a man for the mid and lower third, you will pick the highest G prime product possible that exists in your country. That will always give you the best results.
Okay, let's move down to the jawline a bit.
Okay, so going down to the lower third area, again, I will use a high G prime product. Now, the lower third, you have to realize what's causing the lower third, those not looking up to par. Is it because genetics? Does the patient have a lot of redundant fat on the lower third, maybe on the lower chin? Because if the answer is yes, then you need to use something like deoxycholic acid to get rid of the unwanted fat. Exactly. And sometimes just by doing that, you can get the look that the patient wants, which is a more angular, straight jawline. So if the patient is aging because bone loss, bone remodeling, and also because lack of soft tissue on the lateral aspect in front of the ear, fat accumulation because the descent, or because the ligament in this area is getting loose, then you have to use fillers in this area. And sometimes you have to do a combination of all three. Sometimes for this area to look up to par, I do fillers, I do deoxycholic acid, and I even use threads to keep the area looking up to par and chisel.
In terms of treatment plan, what will you do first? What is the plan? Like, you know, thread first, laser? What is?
So if the patient has redundant fat, let's see if they really genetically has this fat, I treat that first. I can do the threads and the fillers together. I like to do that. I will use a filler that has a high G prime, trying to imitate the ramus of the jawbone is very important. The stronger the ramus of the jawbone, the more you can pull and the more angularity and linearity you can do. So I can use up to 4 to 6 syringes to try to imitate that ramus and make it stronger. And then after I do that, I will use thread this way and this way to lift the skin and make it look even more chisel and angular in that area. So you can do the fillers, different techniques. You can do supraperiosteal. You can fake angularity by going subdermal, or you can add to the illusion, because it's an illusion, of a bare jawline by pulling the skin and condition the skin with a thread in that area or several threads.
So averagely, when you are treating male, do you have how many cc averagely fillers?
For the lower face?
Yeah, for full face.
Well, for full face, okay. So let's see that we have Brad Pitt comes to my practice and he has a lot of money and he wants to look now. And let's see that he has all the problems that I mentioned. He needs frontoplasty, that is 1 to 2 cc's. He needs cheekbones. Usually I try to do the least on the mid face to men. So I will use 1 and 1 on average of a 1 point or 1.5. So let's see, like for the mid face, we'll do 3. Now there's 5 already. 2 for the forehead, 3 cc's for the mid face, and then 4 cc's for the lower face. So anything from 7 to 10 syringes on average. If the patient has a lot of bone loss, bone remodeling, it can go up to 11 syringes to get a correction where the patient is going to be happy. That said, because I don't like to use a lot of syringes, because if you're doing too much, eventually I think you have too much filler on top of the bone, too much filler in the muscle, too much fillers on top of the muscle, too much fillers subdermal, and too much fillers on the dermis. Eventually I think people look a little weird. And that's why I think threads come into place, because it allows me to pull the skin, lift without having to only use fillers to lift. I use fillers more for contouring. Yes, I can lift, but if I need a lot of lifting, I use the threads because it will allow me to use less syringes of a filler, up to 50% less. And I like that because I want my patients to look natural. Imagine that they're going to be doing this for 10 more years. Whether you're the best injector in the world or not, abusing fillers can potentially make the patient look weird if you're trying to imitate every single structure with a gel. That's my take on.
So will you treat the patient at one session, or do you want multiple sessions?
I like to tell you the truth, I like to do multiple sessions. I don't like to do everybody at once, unless it's just 2 areas. But to do frontoplasty and mid-face and lower third, it's not only arduous. I can do it. I'm not a lazy person. Most dermatologists were not. But it becomes dangerous to me. For example, to do a frontoplasty, I like to do that by itself. That's my wish. That's what I like to do, because it's an area that you do not want to rush. It's an area that people can go blind. It's an area that you want to take your time, be patient, do a beautiful job without having to start thinking, oh my God, I'm running behind. I have patients waiting. No, take your time. Patients will appreciate it. And besides, you don't want to rush on anybody's face. I mean, people's face is the most valuable thing they have. It's the presentation card. You need to do a good job and you need to do it safe. So I like to break my treatments into at least 2 parts, where I can do mid-face and lower face. I can do that. But if I'm going to do frontoplasty, I don't want to do anything else that day but that technique. And I think it's the prudent thing to do.
Okay. If anyone wants to know jawline contouring, you will have a section on webinar.
Yes.
Medicom, right? You want to promote that?
Definitely. So I'm going to be doing a webinar for Euromedicon about jawline, and I think it's this Friday. I don't want to say because I have so many, but you can actually go on my Instagram, and I'm going to be promoting it, and it should be there. But it's something that you do not want to miss. We're going to be talking about male rejuvenation on the Euromedicom, and I think it's going to be of value for all of you to want to see how I do this technique, or just to take some pearls, because I'm sure a lot of you are already doing it, but we can always learn something. So stay tuned. Today, I'm probably going to be talking a lot about my social media, so no one misses. You all need to tune in.
And then we move on to complication that might occur. The most common complication that you see in patients.
Okay, so the most common complication that I see is bad neurotoxin. It's like you could tell when the neurotoxin is done by somebody that haven't paid enough attention at the anatomy of the male patient or understand it. They either feminize the brow, or they look like Jack Nicholson or Machiavellic, or they look like something like, you know, the president of the United States. If you look at our president and you look at his Botox, it's sorry, but whoever is doing it is not the right way to do it, because I think it makes him look unapproachable. He already has this personality that he has, so it adds to the way people read him, whether you like him or not personally. I'm just saying that his neurotoxin is not favorable. Yeah, he's not moving. Yeah, he has no wrinkle. Yeah, it makes him look like he's really upset all the time and, you know, pissed at the world. And I think that is somebody, with somebody like him, the technique for him is to not inject the frontalis, just the glabella, and inject the crossfit. He will look more approachable, more gentle, more subtle. I think whoever's injecting it should stop injecting the frontalis, because it's not helping his mission. So that's the most common mistake that I see. Poor neurotoxin technique on the male patient. Then the second,
Give super frozen look on male.
yes, frozen, but then the frontalis is dropping, collapsing on the bridge of the nose, and then the lateral part of the frontal is lifting. So it gives this Machiavellic, mystic, you know, look, like it's just not a nice look. And that's somebody that I can't see. I looked at it, I go, somebody need to stop injecting his frontalis, or let him know that he's not being read well, because that technique doesn't work, right?
Okay, what else did you see in male?
The second thing that I see that is not done well in a male patient is OG curve on a male patient. Too much anterior projection. Exactly. Male, we need to be flatter here. We need to be angled, and we need to be contour. A lot of product on this area is not going to make a male look younger. It's just going to make him look weird. And this is something that robs male beauty. We need to keep that flatter. If you want to make a patient look more attractive, work more laterally. Also, don't make it too big now that you look like a chipmunk. You need to put less product, but enough to see a cheekbone. It's called a cheekbone for a reason. It needs to look like a hard piece of bone in a male. In a female, you can make it nice and round and doughy, like your beautiful face. But in a male, you need to see the bone. When you inject, you need to see the bone, and it needs to look strong. That increases male beauty. So too much product in the anterior projection, or too much product laterally, is not very good for a man. In a man, less is more. I'd rather not do anything to a man and keep him looking distinguished than make him look weird, right?
Yeah, I think so. If ever my husband allow me to treat him, he will get good cheekbone for sure.
For sure, yeah, definitely. And then the last thing is over masculinization of a male. You know, we all want, for example, I have a face that is not very masculine, and I do my jawline because I have bruxism. So I lost a lot of bone prematurely. Yes, so my jawline was blending with my neck. So this only on one side, this is rebuilt. I have polylactic acid, waited 2 months, and then I put calcium hydroxyapatite, and I have a thread. Why? Because it didn't look like this side. Now, on me, I feel, and on my patients, I feel, wow, you look so much better. So I think that improved my secondary male characteristic that makes me look more handsome, right? Because I had this androgynous look, you know, that I had in my whole life. But by doing this, I think like, wow, I feel, you know, like Superman now. It's just, I feel like it's the look that I always wanted. but I did it because my bruxism. Now, somebody that already has a very masculine face, because this procedure is in vogue, everybody sees it in social media and everybody wants it. Sometimes you can over masculinize this area on a man, and instead of making it look attractive, they look like cavemen. They just don't look. So that's another mistake, putting too much, doing too much on an area that doesn't need it or needs just a little bit can also rob male beauty. So if you make the male look feminine, it robs the male beauty. If you make the area too masculine, robs the male beauty, because now you start looking like a caveman. So those are
Okay.
the things that I see.
Yeah. So in male patients, we have some patient who is metrosexual, and some patient like who want them. So do you treat them
Of
differently?
course, of course.
Yeah. What is your recommendation?
So it all depends what the male patients, because we know that the technique changes for what the patient is looking. Now, one thing that I will never do is make my patient look weird. So if I have a patient that is very, very masculine and you can soften the look, you can improve, but you do not want to make them look weird. So if a male needs more male secondary characteristic, let's see that they want to look more masculine, you always want to pick to get the result high G prime product, something that's stiff. The stiffer the product, the more contour and angularity, chiselness that you're going to achieve. For that patient that wants to be a little bit more androgynous or wants to soften the look, then you can use something that is not so stiff, a product that has a less of a G prime. A good example would be a marathon runner patient, somebody that runs a lot and is very gone and chiseled. To that male, you don't want to use a high G prime product because he's gonna look worse. It's gonna look like he's too gone, like he's dying or something. For that male, you're gonna pick a filler that the G prime is softer, not so stiff. So you could see that you can customize your treatments and choose your products according to what the patient wants, the look that the patient wants to achieve, and match those desires with the rheological properties of the filler itself. Because every filler, we have a different performance.
Yeah, and I think you cover most of everything. But of course, if the audience want to learn more from you, please join your medical webinar on April 24th on Friday. I'll
Yeah.
learn.
So April 24th on Friday, we'll be having a webinar about male aesthetics, where we touch anything from, what to do with neurotoxins, what to do to, I want to divide it this way, so you guys have a little preview. We're going to talk about rejuvenation, and those are your older patients, like you baby boomers, anybody that's 50 plus, like myself. I need to do rejuvenation in order to stay younger looking. Then we have the prejuvenation, which are you younger patients. They look young, but it's time to see changes, and they want to be proactive. They want to do something to maintain a youthful face. And then you have the beautification or enhancement. Those are you younger millennials or younger than millennials that really want to enhance. They want to look more attractive. Remember, now with Tinder and Grindr, you need to really look good on your smartphones. So patients, they look at themselves like, I'm looking myself right now, talking to you. I go, oh my God, my teardrop needs to be done because it's been a while. So they do that. They're talking to people, they're doing FaceTime, and they on Tinder and Instagram, and they see the little things changing, and they want to enhance and they want to look better. Everybody wants to look more attractive. I don't know a single person that don't want to look more attractive, right? So it's going to be talking about rejuvenation, rejuvenation, and beautification.
Right. Thank you so much. I think we cover everything for tonight. And I think it's time for to say bye-bye to all.
Okay.
I like you and also for all the good tonight. So see you till the next slide.
I see you during my webinar on this Friday, and I will see you all there. I hope to see you there. Until next time, I love you all. Be safe, improve yourself, learn more things. This is the time to do it. Pledge to be better. Great to see you.
See you next time.
Ciao.
Stay safe.
Ciao. You too.